Okay, so now I am going to do an IV change, continuous to intermediate infusion lock. So first we are going to prepare by checking our orders, 6 rights of medication. We are going to do the right patient, right dose, right medication, right time, right route, right documentation. So we are going to check our orders. We are going to, looks like we are going to be giving Dilaudid 2 milligrams IV push every 2 hours as needed. So we will be checking on that. We will be identifying our patient with 2 forms of identifiers. So we will ask them, what is your name and date of birth? And we are going to do hand hygiene. We are going to assess our IV site. We are going to be clamping all of our tubing, since we will be disconnecting it, so we are going to make sure that those are closed. We are going to place a gauze underneath, and we are going to remove the tubing. Okay, and we are going to flush it. We are going to clean our alcohol, or clean our site with an alcohol prep pad, and then we are going to flush it with 5 cc's of fluid. And then we are going to teach them how to maintain the lock, to make sure that they don't like accidentally rip it out. And then we are going to document all of those. So now we are going to administer our medication through our saline lock. So we're going to review our orders. We are going to check our 6 rights, do it 3 times. So once before, right patient, right medication, right dose, right time, right documentation, right route. We're going to make sure that our orders match our patient, and then we are going to do that again at the bedside. So now we are going to determine the rate for that. So 1 milligram every 2 minutes. So we're gonna have our 2 milligrams per mil and dilute with 2 mils of normal saline. So we will be giving 1 mil every 2 minutes. So we will be doing 1 milligram every 2 minutes. So we are going to administer 1 mil. So it's going to be a 1/2 mil every 2 minutes. So we're gonna do 1 ml of air into our medication vial. We're going to withdraw it. Make sure that we have all of our air bubbles out. And we are going to do our cap. So now that we have our medication drawn up, we are going to flush our site with 5 mils of saline. So we are going to attach 5 mils before, and then we are going to administer medication, which we will do over a slow push, 1/2 mil over the 1/2 mil every 2 minutes, and then the other half over the other. But I will just say that I did that, so we don't have to just sit and wait for 4 minutes. So then we are going to flush again with 5 mils. And then we are going to assess the catheter site. We're going to make sure that there's still no redness, still no kind of reaction, that the patient is good. We are going to dispose of our materials. So then we're going to document our what we had done and all those all that fun stuff. So now I'm going to discontinue our IV. We are going to perform hand hygiene. We are going to prepare or don on gloves. And we are going to gently take off our tape and dispose of it. It's kind of hard to do this on a banana that's just not wanting to. There we go. So we're going to rub all the corners. We're going to be holding on to that catheter tightly. We have our gauze, our sterile gauze. We're going to put pressure on that vein when we pull, and then straight into the biohazard. And we are going to firmly push, put pressure onto that for 2 to 3 minutes. We're going to examine the catheter, and we're going to assess for any redness, any tenderness or swelling, and then we're going to cover our site with a sterile dressing. So our gauze, our sterile gauze, and our tape. We are going to write on those just name, initial, and date. And then we're going to document all of our action or our interventions, and make sure that our patient's comfortable, call light is in place. So hand hygiene afterwards.